The law office of Daniel Horowitz represents physicians. We get a lot of calls about the Stark Law and the AKS, which is the anti-kickback statute. We could lecture for hours and just be starting, but here's a 6-minute quick dive into the Stark Law and anti-kickback statute. First, a quick refresher. Stark Law and AKS are federal laws to prevent financial ties from skewing healthcare decisions. Stark Law bars physicians from referring Medicare patients for certain services to entities they're financially tied to, unless an exception applies. AKS prohibits paying or receiving anything of value to induce referrals for services covered by federal healthcare programs. Both are complex, with hefty penalties for violations, making updates critical. In December 2020, the Centers for Medicare and Medicaid Services, CMS, and the Office of Inspector General, OIG, released final rules to modernize these laws, effective January 19, 2021. The aim was to support value-based care, ease compliance burdens, and foster innovation while guarding against fraud. As of 2025, these rules remain the latest framework. Let's explore the key changes. A major focus is value-based arrangements. Healthcare is shifting from fee-for-service to value-based care, prioritizing quality and outcomes over volume. The 2020 rules introduced new Stark Law exceptions and AKS safe harbors for these arrangements. Providers, like hospitals and physicians, can now share resources such as data tools or care coordinators without violating these laws, provided they meet requirements like improving quality or cutting costs. This flexibility helps providers collaborate on patient outcomes without legal risks. The rules also clarified vague terms. Definitions like fair market value and commercially reasonable were murky, causing uncertainty. The 2020 updates specify that commercially reasonable means an arrangement makes business sense, even if it's not profitable. This clarity helps providers structure agreements, like equipment leases or staff sharing, confidently. Technology got a boost, too. A new AKS safe harbor and Stark exception protect donations of cybersecurity tools or services, like software for secure telehealth or patient data protection. This acknowledges tech's growing role in healthcare and the need for robust security. Providers can accept these donations from hospitals or vendors as long as the intent isn't to induce referrals. Practical tweaks include protections for limited remuneration. Physicians can receive up to $5,000 annually for services, like consulting, without a formal written agreement. This reduces paperwork for low-risk payments, especially for smaller practices. There's also a low-risk exception for arrangements like community health programs, where financial ties are minimal and patient care is the priority. What is the landscape now? The law continues to evolve to support value-based care, encouraging innovations like telehealth or shared savings programs. However, compliance remains key. Arrangements must be transparent, documented, and not tied to referral volume. Audits and enforcement are still active, so providers must stay vigilant. Smaller practices may need legal guidance to navigate the complexity, as Stark and AKS interplay can be tricky. Finally, one warning. We are conservative in our recommendations to physicians. Certain practices that we believe may potentially violate the Stark Law or the AKS are often approved by other lawyers. Are they right? Are we wrong? Our concern is that regulators and law enforcement agencies can be slow to arrive at the show, but once they get there, they are like pit bulls and don't let go. We are forward-looking and try to steer you to a place where you can sleep at night. If you've gone past the point of no return, or you are concerned that you are close to the line, seek legal help.
We thank Dr. Baum and Kevin MD for their contributions to the medical and legal community. A successful practice can take pressure from you, the caring doctor, and allow you to focus on patient care. We hope that our summary of the recommendations has been useful to you. If you run into trouble in terms of business disputes, licensing issues, peer review or medical malpractice, the Horowitz Law Firm is there to assist you. Call us at 925 283 1863. Again, that number is 925 283